Well, Saturday across the state, it was good to see hundreds of people standing in line for the flu vaccine as they're trying to stave off what has become once again an epidemic. Joining me to talk about where we are with this year's flu season, I'm happy to have Dr. Jack Ross, the Chief of Infectious Diseases at Hartford Hospital. We've already been having a nice chat about influenza and what it means each year. Good to see you again, Doctor.
Thank you.
Glad to have you here. I know we talk about it being a bad season every year. I guess it's all perspective. It was only 100 years ago with the Spanish flu epidemic that about 5% of the world passed away. So we're doing better in that respect. But there are still some pretty significant numbers, I think, that are being projected for infections and deaths worldwide from the flu this season.
Yeah, in the average year, we will see between 3 to 5 million cases of severe flu across the globe.
Yeah.
In the United States, we may have 150 to 650,000 hospitalizations. This year's been a little bit different in that we saw a much earlier season. We started mid-November, whereas usually for us it's after Christmas. We saw the cases at Hartford Hospital at least peak around the week of January 9th to 10th. Well, we had 42 people in house with influenza at that time. Last Friday we were down to 20.
Okay.
So I'd say it's shaping up to be moderate to severe compared to our usual years. What I do think we're going to see is we're going to see another 2 to 4 weeks with the activity we're seeing right now, which is heavy.
Okay. The CDC said the flu is widespread in Connecticut this year, and I was talking to you before. I feel like they do that every year. So in some ways, maybe they're not necessarily doing themselves the best service because it'll tend to go in one ear and out the other. But this is, regardless of whether it happens every year, this is considered widespread. This is a concern, yes?
It is widespread, and you're correct. Generally, it becomes widespread every year, but usually more sequentially. This year, it seems to be happening all at once, and again, as I mentioned earlier.
I know people over 65 and people who are immunocompromised, I imagine, are making up the bulk of the cases. But we did have a 10-year-old New Canaan boy who appeared to have been infected with the flu. How is it hitting in terms of hospitalizations and infection rates with schools this year? Is that any different than any?
There are schools that are thinking about restricting visitors. We're seeing the bulk of it this year, though, 80% in people between the ages of 30 up to 100. I know at Hartford, 8 out of 10 people we're seeing with it are over 30.
Is that unusual?
And about 45% are over 65. That is, we usually have between 25–40% over 65.
Okay. Does that have anything to do with what the prevalent strains are this year with H3N2?
It's a great question. 2015, 2014, that season, we saw H3N2, and we also saw the elderly more impacted than others. So I think that's a big part of it. Okay. Plus, there's issues perhaps with the vaccine this year for that strain.
Yeah. How do you think the vaccine is working? We've been talking about this before. I'm not sure exactly what the success rate's going to be.
First thing I would tell folks is make sure you do get a flu shot, regardless of the number that's put out there. But secondly, in the average year, the flu shot overall, depending on age, may be between 40 and 60% effective. This year, there's preliminary information from Australia that it might only be 10 or 11% against the H3N2 strain. CDC right now is analyzing that. We won't have that number till late in the spring in 2018.
How will people out there know if they have the flu versus just a cold? How long will it take for them to tell, and what does that do? What does that mean in regards of trying to get Tamiflu? Because I think time is somewhat of the essence with Tamiflu, is it not?
There's 2 points there that you made that are important. Number one, influenza has a wide spectrum of symptoms. You can be almost asymptomatic in a small number of people. But for most of us, you'll know it's like getting hit by a truck. You want to take to your bed, you want to shake, and you don't want to really move from that bed for a couple of days. After it leaves you, you may feel sick for 7 to 14 days with just fatigue and perhaps some of the myalgias and hard just getting going again. In terms of Tamiflu, what we generally recommend is for all people hospitalized or those who are at higher risk for complications. The average person, it'd be nice if we had enough, but there have been some spot shortages of Tamiflu across the country. We'd like to save it for those at high risk who develop influenza or those who get hospitalized.
Okay, so there you go. Doctor, thank you so much. Doing everything you can to try to fight this spread. Handshaking, by the way, if you're curious, I asked, does he do it? He says yes. That's why we have Purell. Also a very good thing.